Hey there, welcome back. All right, so we are going to do another author interview here, and we have my good friend Mark Graban here. So Mark is actually in town, so we were nice enough to go out to go have lunch together. As some folks that follow the podcast know, and some of my blog writing, Mark and I used to actually be neighbors, and it was kind of a funny story. When I first started my blog back in the day, I didn't know what I was doing, so I was reading some of these other guys, and Mark was one of the guys that I was reading, and sent you an email, and he replied back nice enough.
And I said, I don't know what I'm doing either.
Yeah, no. And so, and then I said, well, I'm in Texas. And you said, I'm in Texas.
Yeah, where in Texas?
And come to find out, we lived 10 minutes from each other, went to the same church, everything. So it was kind of a crazy story. But now you've sold out and gone off to Spurs land in San Antonio and all that. So a good time to be in San Antonio, I guess.
Yeah.
But anyhow, what we're going to do today in this video is we're going to talk about Mark's book, his first book, Lean Hospitals, Improving Quality, Patient Safety, and Employee Engagement. And we're going to do another video here on your second book, Healthcare Kaizen, so we'll do that shortly. But what we're going to do is just kind of walk through. There's 12 chapters in this book, so we're not going to go through each chapter like we did with Karen Martin, but we're going to kind of cherry pick a few chapters and pick your brain a little bit about what this book's all about. But what I want to do is start with the blurb here on the back, and this is from John Toussaint, who is the CEO of ThedaCare. Is he still the CEO?
Well, he's now the CEO of the ThedaCare Center for Healthcare Value. And has been for about 5 years now.
Yeah.
But he had been CEO of the ThedaCare Health System previously.
Whether it's the ThedaCare story, Seattle Children's, or Virginia Mason, the answer is in. Lean works. The question now for all of you is, how are you going to do it? What's the leadership model required? Well, there will be many questions, and I believe starting with Mark Graban's updated book, Lean Hospitals, is a good first step. This book lays out the nuts and bolts of the lean methodology and describes the more difficult challenges, which have to do with managing change. I wish I could have read this in 2004, as it might have prevented some of the mistakes we made in our own lean transformation journey. So that's a pretty nice blurb.
Very kind words from John.
Absolutely. Yeah. And on a few pages in, there's tons more kind words that I was reading from other folks. So a lot of good press on this book. So first question I have for you, Mark, is, well, first of all, when did you write this? The first edition, not the second edition.
The first edition came out in August of 2008, which meant the way publishing goes, I was writing it in late 2007. Yeah. Publishing
not the leanest process
is not the leanest industry or process in the world. But we did a second edition that came out in 2011 with some updated case studies, some updated data and examples. So just trying to continuously improve a book. Continuous means every couple of years is about the only chance you get.
Exactly. So what I want to do is just we're going to step through just a few of the chapters and have you kind of give us a highlight of what that chapter is about. And then, but maybe before that, just at an elevator speech level, what is the book about and who should read it?
Well, the book is written mainly for an audience of people in healthcare who have heard something about the word lean and are looking for a first introductory book about the topic. It turns out the secondary audience for the book are people who really know lean well, who are trying to shift from a different industry like manufacturing or other services into healthcare. So I've had a lot of people who've read the book for that purpose, but the primary audience are people in healthcare that are trying to improve patient care, improve their organization, and to have a book that, the best we can in a single book introduce the methods and the mindsets and the management system of lean.
Got it. Okay, well, the first chapter I want to just ask you about is chapter 1, the case for lean hospitals. What was this chapter all about, and what are some of the good nuggets that are in there?
Well, I think I think the key there is to help people kind of reflect on. They understand what the problems in healthcare are, but to think through some of those problems in the context of lean and how lean can help. If organizations are under financial pressure, where reimbursements are lower and they need to reduce costs. We can do so by reducing waste instead of doing what a lot of hospitals would do, and that's lay off people. So kind of presenting lean as an alternative strategy to solve some of the problems that really matter. The crisis and the problem around patient safety is something that lean really helps address. And that first chapter is really meant just to sort of lay out the argument and set the kind of ground the discussion of, well, why are we doing this? It's not to go and implement lean. It's about strengthening the organization, the health system for the long term, improving things for the patients and for the people who work there.
Yeah, got it. Okay. Chapter 5 is interesting to me, standardized work as a foundation of lean. So obviously for, folks in maybe a manufacturing industry or, you might be a more traditional lean office kind of industry, standardized work is extremely important. So what did you write about in this chapter as it relates to healthcare?
Well, I think there's a couple of key points. One is just to think about, again, back to that reason, why would we kind of further standardize a process, or why would we write standardized work documentation and manage that as an ongoing process? So when we see problems in healthcare, errors, delays in patient care, and we start asking why, as we talk about in a later chapter, kind of doing some problem solving and root cause analysis, a lot of times you discover different people doing things different ways, which leads to confusion. It can lead to errors. It can lead to delays. And so I try to frame standardized work as not being a primary goal, but as being a helpful countermeasure to a lot of the problems that we have in healthcare.
One question I always have is, many of much of the resistance that we get as lean thinkers is that, I don't want to be a robot, or I don't want to be told what to do. So did you address anything like that in this chapter?
Yeah, I think in a couple of ways. I drew quite a bit on definitions that came from Toyota and Taiichi Ono, and lessons that I had read and learned and had reinforced by people that I actually worked with. Including one, the idea that standardized work is written by the people who do the work. That it's an inclusive process. It's not dictated by managers or an outside consultant or an expert or a best practice. That we go through this process of understanding our work, observing the current work, identifying problems, and documenting our best way. So that's one element, one way in which people aren't treated as robots. We're engaging them in that process of identifying waste and figuring out the best way. But then in the chapter, I also talk about the difference between standardized and identical. So a lot of times people make a leap and they say, well, we can't standardize that because we have different types of patients. And like, well, standardized work, as you tend to see in Toyota publications, I think has a different meaning than standard work. Standard, I think to a lot of people, right or wrong, sounds inflexible or very absolute. Well, I think in standardized work, you look at the process and say, well, here are certain key elements that should be done in a consistent way, unless we have a reason not to. And then here are certain practices where the level of detail doesn't really impact quality or the patient experience or safety. So I think we have to pick and choose what are the key processes to standardize for what purpose, and then at what level of detail does it really need to be standardized. I think those are important things because healthcare is a very high variability environment. It's more for people in manufacturing.
Job shop.
It's more like a job shop than an assembly line with a highly engineered, highly consistent, highly repeatable process. But if you look at lean, even in a factory where it's highly repetitive, people are not treated as robots because they're engaged, they're involved.
Well, and standards are meant to be improved, right?
And that's the key piece around Kaizen.
Right.
And the reason Joe Schwartz and I wrote a whole book about that, this notion of standards and standardized work not being carved in stone, that's just the best way we know right now, and it can always be made better.
Yeah, exactly. Okay, so chapter 8 is obviously an extremely important. They're all important, but this one especially in that it's about preventing errors and harm.
Right.
So what's the gist of this chapter, Mark?
Well, I think, for one, I tried to focus on patient safety and quality and patient flow, which we're going to talk about next. But I think that comes back, that comes from my roots in manufacturing, of having learned kind of an order of priority. First off, safety. Nobody should get hurt at work. In healthcare, I think we can translate that saying, well, none of the employees should get hurt, none of the patients should get hurt. There's a real obligation on a lot of levels to do that first thing first. A lot of people have, I think, a misperception. They label lean as being all about efficiency or being a cost reduction strategy. And what I learned in manufacturing, and I think what resonates with people and translates well into healthcare, is saying, well, no, it's really about improving safety and quality, improving flow. That probably leads to lower cost and better efficiency. But first things first, there's just such horrible levels of patient harm, injury, and death that occurs due to not bad people, but bad processes, bad systems, and that's what I think we really need to focus on in healthcare. Rather than getting into the weeds and working on things that are perhaps trivial, we really need to focus on the most important problems. And I think in most settings, not just in the U.S., but in other countries, that's quality and patient safety.
Yeah, exactly. Okay, so chapter 9 then is about improving flow. So how does flow work within a hospital?
Well, so we look at different types of flow. I think we focus on patient flow. How long are you having to wait in the waiting room at the emergency room? How long are you having to wait to get a bed, or your surgeries being delayed?
Right.
And then we can look at different types of flow. The flow of a tube of blood. If a specimen's been collected, how long does it take to get that test processed and reported back? Looking at the flow of medications. And I think some of the key lessons that, again, come from other industries is that we don't improve flow by doing the work faster. We improve flow by reducing delays. Looking at the value stream, the end-to-end process, and trying to improve the handoffs between functions, between departments. That we're focused on flow, not efficiency. I think there's this kind of old-fashioned, we saw this in other industries, efficiency view that says, well, the primary goal is to keep everybody busy because that keeps our costs low. When in a lot of cases, that you're looking at accounting rules and cost absorption, but I think the lean lesson. Lean practice is to focus on that flow and let cost be an end result of that. So the way to maximize flow in any process is not to have everybody be 100% busy. And that sounds counterintuitive, or maybe that sounds wrong. But a lot of times in healthcare, we're trying to convince people to focus on that flow instead of departmental efficiencies, which are driven by budgets and costs and accounting, instead of focusing on the overall patient experience.
Okay, so the last chapter I want to touch on in this book review is chapter 10, Engaging and Leading Employees. What's that all about?
Well, so, I try to have this be a common theme throughout the book of lean not being just a bunch of projects or a bunch of tools and methods, but also being a philosophy and a way of thinking and a way of managing. So, there's other chapters about problem solving and engaging people in that process. And in this chapter, really try to emphasize some of the core elements of the lean management system. That this isn't just about fixing processes; it's also about managing differently, treating people with respect. As I touch on in other chapters, when there's a problem, not blaming the individuals, but looking at the process, looking at the system, really trying to help. If people are going to start off with projects in lean tools. My hope and my goal, and I think what would lead to people being more successful, is also focusing on that management system. And lean is an ongoing process, so that we don't say, lean, we did that last year. It's really something you continue doing, and it's like we're preaching to the choir, I think, with the Gemba Academy audience. But that was an important message that I was trying to get across to people in healthcare, for whom this is brand new.
Okay. Now, how many different languages has this been translated into?
It's being being translated into 8 languages.
Wow. So you have English, obviously. Well, do you know them off the top of your head?
Yeah. Well, the ones that I actually have on my shelf at home include Turkish, Thai.
Wow.
Chinese, so I have what they call simplified Chinese characters. It's also supposedly being translated into complex Chinese characters. Hungarian. I have a copy in Arabic.
Wow.
Which was translated through some people I know in UAE who worked with a professor in Egypt. And so, it's interesting. It's not the more popular languages like Spanish or German or French, but it's been translated in countries where a publisher was willing to go through that translation and work with Productivity Press to bring it to print in a different country. So it's still it blows me away to see these different versions and different languages. And I think it goes to show that lean is not a set of Japanese practices, quote unquote. It's pretty universal.
Yep.
And I've been lucky to work with and visit hospitals in a lot of countries, and the high-level health system in different countries might be different. How you pay for health care, how you get insurance or coverage. But when you look at how care is being delivered, and that's what this book is about.
Sure.
Healthcare delivery, healthcare operations, the problems and the waste, and the underlying human dynamics are very, very similar. So I think this set of concepts, it does translate well.
So one thing we didn't mention is that you did win the Shingo Prize as a result of writing this book. So very well done on that.
Thank you.
So, all right. So I guess books available anywhere books are sold.
Anywhere books are sold, online generally, but that's the way the world works these days.
And we'll have a link here for Gemba Academy customers to buy that if they're interested. So Mark, well done. Thanks for coming on, and we'll talk soon.
My pleasure. Thanks.